chairman, Korle-Bu Teaching Hospital, one of the hospitals whose name has constantly come up when it comes to this. They are supposed to be our standard, but has been our biggest disappointment. Prof, thank you very much for your time. Good morning to you.
Good morning. Good morning to your listeners. And let me say our deepest condolences to the family of our late coordinator who passed on. A very sad spectacle we have as a nation at this time.
Well, a few things though, because I know you know the system very well. You've worked in these hospitals in various capacity. You've also even led the doctors' front, among others. Where is the problem coming from?
All right. It is a very big systemic problem. A problem that has arisen from years of lack of consistent investment in our healthcare that is not meeting the expansion of the population. So if you take Korle-Bu built in 1923, and some of the things that Korle-Bu could even do at the time it was commissioned, today Korle-Bu is not able to do them. It's just because over the years we have not invested appropriately as far as health is concerned. However, the other thing too is there are other structural problems. I did state yesterday in Parliament that, for instance, the WHO recommends 2 to 5 beds per population. Ghana is currently doing about 0.9 beds per population, not even up to 1 bed per 1,000 population. That's what I mean. So you realize that structurally we are deficient there. But the few we have doesn't appear to also be managed very well. And that is the angle that the current government is bringing in. I think hopefully there's some hope. The minister is bringing some solution to this, and maybe we'll go into this. But then the other block, so apart from the systemic thing, the years of lack of consistent investment, the other one is also attitudinal, where sometimes we just, health workers just fall a little below the mark and don't go the extra mile to help. I think this will, in a nutshell, summarize what the situation is.
I see. Did you say 1 bed to 1,000?
Yes.
That's our current situation.
The WHO recommends that you should have at least 2 to 5 beds, hospital beds, to 1,000 of your population.
Okay.
Ghana has less than 1 bed to 1,000. We are around 0.9.
I see.
Yes.
Okay.
And if you look at it, until recently, over the years, we have been developing our healthcare system and not focusing on the emergency setup. Emergencies were never, they were considered as an afterthought of hospital. And most hospitals, if you go, the emergency unit is the smallest unit of the hospital. But that's also the most critical part that determines whether someone survives or lives. So this is what I mean by the lack of consistent investment over the years.
I see. So would a law solve these problems? Or how far will a law go?
So a law can help. But we also have existing laws that, if well implemented, could also help solve the problem. When I say a law can help, I think when I went to Parliament, one of my first statements I made in Parliament, I said that I made a statement on pre-hospital emergency care on the floor of Parliament. And it was to the effect that if you look at the structure of our ambulance system, if you look at our public preparedness for emergencies, if you look at emergency preparedness in public places like the stadia, like Parliament, like the lorry station, and compare it to developed countries, we are not up to scratch. Our public knowledge on pre-hospital emergency is very, very, very minimal. If someone collapses today, what do we see in our movies? Nobody does a CPR. Nobody calls a special damper. All they will do is screaming, pouring water, pouring oil, doing all sorts of things on the person, which is not based in any science. A law can help in that aspect to make it mandatory for people to institute certain measures in public places for public safety. A law may also help in the emergency care. especially if it is one that raises funds and directs how the funds should be used to provide emergency. Because we have policies, but policies sometimes are not binding in terms of law. You can't punish someone based on policy. So there's a policy in this country that says that anybody brought into the emergency from a trauma, first 48 hours, provide free care. My brother, you and I know that there is nothing called free. Somebody has to pay for it. So either there is a law that generates resources earmarked for that free. We can look at our average accident rate and say as a nation, maybe we've had this number of casualties, this number of bull rush, the various ERs in the country. On the basis of that, we need 10 million in a year or 20 million in a year to cater for people for free in the first 48 hours. And in that instance, use a law to earmark some funds for it, and that money then be made available to the hospitals through a special requisition system so they can care for everybody who comes and be provided for.
But ultimately,
So,
okay.
yes. So these are the action areas in which I think laws can help. But ultimately, we need to manage what we have better and have a better attitude towards what we have and towards our fellow human. And we can still make the most out of our current situation.
Very interesting, because when you still talk about the law, it seems you're going back to the issue of money, investment, funds. That if this law can guarantee that there will be money made available and that money is used for particular purposes, we will get somewhere. Did I get you right?
Exactly. Because if you pass a law that everybody must eat 3 times a day to stay healthy, and you don't provide food, can the law be implemented? If you pass a law that everybody should sleep at 6, and people should enter their room and go and sleep, and they enter their room and they are hungry, and they can't sleep. They'll be in their room, but they are not sleeping. The purpose for which you wanted them to sleep, you will not get a benefit. So I'm saying that a law can help to the extent that that law makes money available for investment in the emergency care. And then it can subsequently prescribe punishment when people fail to meet the standard required of them in that investment. Because if not that, and you just legislate it. So I support speakers thinking that we may need to legislate it. But that legislation should be looking at the root cause. The root cause is that we have not put our investment where it's needed most, as far as healthcare is concerned. But I would always end by saying that there's a lot of hope in the horizon, because I can see some consistent effort from our current Minister of Health to solve this problem prior to any law being passed, because he's trying to use an IT and an AI system put together to map out all hospital beds in this country. At real time, we should be able to tell beds that are occupied, that are not occupied. We should be able to monitor the behavior of health workers as far as the utilization of these beds are concerned. People should be able to call into a command center and know the nearest hospital where they can get an emergency care for a particular thing. And so if something like that is implemented very well, we should be able to make progress. But all of that, again, will come down to money. So in my submission yesterday, I asked that we should try to, Parliament should support the minister in this regard, because it may require money, it may require some support, and when all that comes, I'm sure we are all going to benefit as a people.
The other things you mentioned, you talked about the poor management. You also talked about systemic issues. You talk about attitudes. Now, those 3 things, how do we resolve them? What's the best way to resolve them?
So, I mean, in terms of spheres of control, I would say that the systemic management falls within the control of the ministry. And that is what the minister is trying to do now, to make sure that we can utilize what we have well. Make sure that we have properly trained emergency physicians, emergency nurses, critical care nurses distributed across the country equitably, so that everybody can access good health care. That angle is being taken care of. When we look at the structural issues, when we are building new hospitals, we must not make the emergency an afterthought, a small portion of the hospital. We must know that that is actually the nerve center of the hospital and invest appropriately in the structure and so that it can meet its function requirement. Then we go to the attitude. And attitude and human behavior is the reason why we have laws. You can encourage people to behave well by admonition. You can also encourage people to behave well by punishment, by correctional measures. And when you have provided everything somebody needs to work, and the person will simply not work, you would have to find a way of dealing with that person. And people must be monitored in what they do. I have said it, look, if you go elsewhere, you report to the emergency center, you are not allowed to use a phone. You are given 2 hours phone break or a nap break where you can sleep for 2 hours. And you are working in the night. The rest of the time, you are in the line of duty, working. What do we see here? You go to a typical emergency, somebody is in excruciating pain, and someone is talking on the phone and laughing and chatting. In fact, the aesthetic doesn't even look good. It doesn't, because can't you empathize with me, with the kind of pain I'm going through? At least show some sympathy. You enter an emergency somewhere, you see how everybody is rushing to come in and help. You rush with the ambulance with somebody, or you with your hazard light, and get to the hospital and realize that everybody is very slow. They are not bothered. What is that? What at all? What haven't we seen before? Those are the attitudinal problems we talk about. But that will only happen where we have systems that check. It's not as if the other places where people are working so quick, if they were given the opportunity, they won't slow down. They are working that way because there is a monitoring system to see when the person entered the emergency first 30 minutes, what was done. And they can track who saw the patient. And that first 30 minutes, what did you do? What is our benchmark? Were you able to meet it? And if not, there are consequences. So when we put this infrastructure in, where we can guarantee that people who go to work must work, and then we can see a real change in attitude, because those who will not change will be forced to change. So this is how I think we can go around. And I think that, as I've mentioned, the solutions being preferred by the current health minister may help us a lot, because until we can track, if you say there is no bed, what exactly does it mean? And yesterday I gave that explanation in Parliament. People just think it's like there's no bed for someone to lie on. Sometimes it's a special bed that you want and it's not there. The patient needs blood. If I keep him in my hospital, I don't have blood, the patient will die. So they will tell you, I cannot take the patient. So I have no bed. It doesn't mean there's no physical bed for you to lie on, but what you need when you have received that bed, they don't have it. You need ICU care. The whole Korle-Bu for a long time didn't have more than 10 ICU beds. But look at the size of the hospital and the size of the population. What investment are we making in that direction? When the incident happened in Tamale, minister had to donate an emergency ventilator to them. It just tells you the level of investment as far as these areas are concerned. So gradually, I think we will get there. There is hope. And I just want to add that I know minister had been working on this thing before this issue came up. And so it's unfortunate this has happened at about this time. But I was confident that maybe in about a month or so, he may have come public with what he's been doing in the background to solve this no bed syndrome. But unfortunately, this has taken us off guard just before we will even get there. But hopefully we will have a solution.
Prof, I know I'm hijacking from another engagement, so I'll end it here because there are many other issues to deal with.
Yeah.
My producer will get in touch. We'll make an arrangement so that we can talk extensively. But thank you.
Most grateful.
Thank you for speaking to us. Professor Titus Beyuo is member of parliament for Lambussie and board chairman Korle-Bu Teaching Hospital. We didn't even talk about Korle-Bu. There's a lot to talk about whenever it comes to Korle-Bu, and because I didn't even talk about the way I introduced Korle-Bu. Anyway, this morning, one of the people will be having our guest in studio this morning from 9 a.m. If you are checking our Facebook page, you'll know by now that we'll have the person who is responsible for the Tree Crops Development Authority join us, the Ghana Tree Crops Development Authority. He'll be joining us in studio. We'll be having a conversation on it. His name is Dr. Andy Osei Okra. Dr. Andy Osei Okra. We'll be having a conversation on the summit and exhibition they held recently. We'll talk about what he's supposed to do, what his work is, and what his own vision for tree crops development specifically is.